A year and a half ago, Daniel Duarte started dropping a lot of weight. Was that concerning you as you went from 290 to 240? Did you realize something was wrong?
Yeah, definitely.
Having quit his full-time job at a dairy to freelance in the catering business, gambling he wouldn't need the insurance, Daniel didn't go to the doctor until he could no longer eat. The diagnosis, stage 4 stomach cancer. Medicaid paid for his surgery last April. Would you be in a different place if you had health insurance?
No, totally. I would have been able to go to a doctor like maybe last year.
Well, we found that 45,000 Americans are dying annually due to lack of health insurance.
Dr. Steffi Woolhandler was part of a team that tracked more than 9,000 people for up to 13 years, comparing the health of those with insurance to those without. After factoring in education and income, smoking, drinking, obesity, researchers found the uninsured had about a 40% higher risk of death. In 1993, it was 25%.
We've got lots of good treatments for high blood pressure, diabetes, and high cholesterol, but we can't do anything for the patients if they can't afford to come to their offices.
Well, I think this study is not well done.
John Goodman of the National Center for Policy Analysis says the study results are exaggerated. Researchers don't know how the uninsured died or if they were uninsured the entire time they were being tracked. But even this critic agrees with the basic premise.
I think you can't trust the results. Having said that, we ought to do something for the uninsured.
Of course, it's not getting any easier to provide health insurance. According to the Kaiser Family Foundation, the average cost of a family health insurance policy is now more than $13,000, having more than doubled this decade. Jim Axelrod, CBS News, New York.
Do you solemnly swear to tell the truth?
This is Nancy Cordes at the Capitol. It was a rare sight. Leaders from the nation's largest insurers sitting down to get grilled.
Which of you, if any, give bonuses for folks who deny coverage?
I'm sorry, Congressman, without going back and doing research on that topic, I really could not give a responsive answer to that question.
You don't know the answer to that question? Is that what you're telling me?
Yes, sir.
Members of Congress pushed the top brass from Cigna, Humana, Aetna, and more to explain why premiums have shot up 131% in the past 10 years.
For every dollar we take in, we make about 5 cents in profit, pay about 84 cents in medical claims.
Lawmakers accused the insurers of putting profits before customers. Customers like 2-year-old Sydney Gendernalik from Los Angeles.
Whoop. That's one of her seizure events she's having right now.
Who suffers from a rare syndrome known as infant spasms.
She can have over 50 of these a day.
From the moment Sydney was diagnosed at 3 months, her insurer, Regal Medical Group, began denying treatments, tests, and drugs.
There's a part of me that's lost an opportunity to be my daughter's father. Because I have to be out there spending time and effort battling one referral to the next, one authorization for a drug to the next. It's not right.
The 6 executives insisted they support reform to a point.
We believe if those reforms are enacted, then a government-run plan is not necessary.
We would not have a level playing field since insurers are subject to taxes and other types of expenses.
Even more notable than what the insurance companies said was the fact that they said it at all. Normally, they like to stay out of the spotlight and let their national lobby defend their practices. Katie?
Nancy Cordes reporting from Capitol Hill tonight.